What happens now, we talked about this cavities, periodontal disease. How do you fix that?
Guys, let's get started.
So cavities, for example, it's a group of bacteria, it's a specific type that will corrode your teeth if you leave, sugar and, especially refined sugar behind. And that can be painful, that can be costly, but once that happens, we need to replace that structure that went away somehow. That can be in the beginning with simple fillings. If it develops into something deeper or more extensive, sometimes root canals, and then crowns, bridges, implants, something that will replace that tooth that was broken or is no longer there. That's cavities. That's a different type and one of the major problems in the mouth. The other major player here is periodontal disease. It's a different type of bacteria that instead of destroying your teeth, will destroy the tissue that supports that tooth. So ligaments, bone, all went away once that periodontal disease was developed. Right now you have teeth that are loose or teeth that are, shifting, changing positions, and that's a whole different type of treatment. So that requires more prevention, requires visits that are more frequent, every 3 months or every 4 months. So that control will actually be required by a specific program with the hygienists and the doctors. Regardless of where you are financially, there's no excuse for not doing treatment. Periodontal disease, for example, it can be a silent problem. Patients sometimes don't even know they have it. So what happens is that quite often we get patients that come to us for cosmetics, for beautification, and there's an underlying problem that wasn't addressed ever. And we break the news saying, hey, your teeth are losing support, and they get shocked. Let's go back to that triple objective that we have here. So infection control, first of all, we need to get rid of anything that's causing harm, right? That's affecting not only your mouth, but your overall health. Restoring function. So you need to be able to chew your food. You need to be able to bite, right? So if you're not chewing your food is going to your digestive system not broken down correctly, and then it's not going to be absorbed correctly. So it's all connected, right? People oftentimes, they have problems with their teeth, they're not chewing well, and they are anemic, or they have other problems that they don't relate necessarily, but they are related. And beautification is the last thing we're gonna do. Unless you're healthy and you come for a smile makeover, if you're not healthy, you're gonna treat your mouth to get to a healthy state before we can actually beautify it. So regardless of where you are financially, let's say patients that will come at a point where your teeth are no longer good, your teeth are compromised, and now, we can't save them anymore. But you didn't know that. You want the teeth to be beautiful and white and, straight. So how do we get there? Is that a costly treatment? Yes, it is. But before we get to that point, let's take care of the foundation. Nobody will build a mansion on a sandbar, right? So it's the same thing here. We have to treat the foundation so you're healthy. Eventually you'll get to where you are, where you want to be with your beautiful smile. That can be done in several different ways.